What if I say not all kidney stones require surgery, but all of them require attention? Hello everyone, welcome back to my channel. Today I'll be talking about something which you have heard very often, the kidney stones or the renal calculi, in medical terms the nephrolithiasis. So before I begin, I want to tell you what is the exact cause for the formation of kidney stone. Kidney stones form when the urine becomes concentrated. By the term concentrated, I mean the solutes are more than the water content. Normally in the urine, there are certain inhibitors to these solutes so that the crystals will not be formed. But when the urine becomes concentrated, it can be because of low water intake, recurrent urinary tract infections or any other metabolic factors. Due to that, when the urine becomes concentrated, these inhibitors, they don't function normally. That is, the crystals or the solutes concentration increases so that they don't get dissolved in the urine, that is the water. So what happens is that these extra solutes, they form crystals and they get deposited in certain parts of the urinary system, and that is what is called the urinary stones or the kidney stones. Now coming to the symptoms. Not all kidney stones are symptomatic. It depends on the size and the location of the formation of kidney stones. If the kidney stones or the renal calculi are formed at the renal pelvis or the kidney proper, usually they are symptomless unless they are complicated or there is a severe obstruction. If the urinary calculi is in between the kidney and the bladder, that is in the ureter, this causes severe colicky pain, most commonly either in the lower back or on the sides, that is in the sides of your abdomen, either right or left, and this sharp pain radiates to the anterior abdomen or your stomach or your groin region. So this sharp colicky pain will be associated with hematuria, that is blood in the urine. If the urinary calculi is located at the uretrovesicular junction, then the symptoms is mostly related to the urinary urgency, frequency, pain, burning during micturition, etc. So the most common symptoms you need to notice is the pain and the hematuria, that is the blood in the urine, and this may be associated with nausea, vomiting, fever, etc. Coming to the management part, not all renal stones require treatment. It depends on the size of the renal stone. Now, if the renal stone is of 0 to 5 mm, then it can pass naturally with increased hydration, that is, you need to drink more water. So people ask, how much liter should I drink? The exact value varies from person to person, but make sure that your urine output is more than 2 liters so that the urine concentration reduces. If the urinary stone is of the size range from 5 to 7 mm, it may pass naturally, but they may require medical assistance. But if the range is more than 7 mm to some centimeters, then obviously they require medical assistance, either medicines or surgery. But surgery until it is very severe, causing both ureter obstruction or causing some other complications, until then surgery is not that required. That is why in the beginning I mentioned not all renal stones require surgery, but everyone requires attention. Coming to the homeopathic aspect of treating the renal calculi, there are not many medicines which can be used. But in homeopathy, we follow an individualized approach, treating a patient as a person. So these medicines not only helps in treating the calculi, but it prevents the recurrence of formation. That is, certain people, they have a tendency to form again and again. Even though the surgery is done, next time again they start getting the renal calculi. So in such cases, this tendency for the recurrent formation of stones, so that can be reduced. That is the individualized approach followed in homeopathy. This was all about renal stone. Comment below if anyone of you is suffering any of the symptoms, or you can DM for any guidance. Thank you. Stay tuned for more videos. See you in the next video, and don't forget to like, share and subscribe.